Namaskar, I'm Ashok Vyas and I have a distinct pleasure of welcoming Dr. Sudhir Bhandari, Senior Professor, SMS Medical College, Jaipur. And we are talking here at Houston. Dr. Bhandari's talk, or rather lecture, as a part of CME, which is continuing medical education to doctors. On a very important subject that relates to one and all. And I take this opportunity also, Dr. Saab, in your presence to share that we are talking to that special physician who is also entrusted the responsibility of taking care of the health of Governor of Rajasthan and Chief Minister of Rajasthan. And there are many special fellowships that are also a part of the introduction of Sudhir. So I would request you first share with us, you are fellow of?
I'm fellow of Royal College of Physicians of London as well as Edinburgh. I also got fellowship of American College of Physicians as well as American College of Endocrinology, along with many of the national fellowships. And I'm working as a senior professor of medicine and taking care of diabetes and endocrinology also as SMS Hospital, Jaipur.
Wonderful. So let us jump to the subject that is your favorite, and you love to educate and increase awareness among people about how they can prevent or take care of their diabetes, and of course other areas. But let's talk about diabetes. So there are shocking statistics that we have, especially in India. And in your talk, I came to know about the distinction between let us say people who are below the line of richness, as we say. So it is now surrounding everyone.
Your observations are very correct. India is facing a big challenge of diabetes. We are going to be the diabetic capital of the world. But at the same time, we are gearing up to meet out this challenge. And we have very high incidence to the tune of 10 to 15% known diabetics. But the bigger challenge is equal number of patients are unaware and they are undiagnosed diabetics. Indians are little different than the Western world or the Caucasians because we have certain issues of more complications in the kidneys, more complications in the heart and eye, as well as we have a strange problem of diabesity. Diabesity is a term used to combine the obesity and diabetes, which is a problem of our country. And we are tackling it very nicely and better. You know, we are a very foodie country. We have a carbohydrate rich diet. Our food is very rich. Food is very elite. At the same time, our activity levels are little low. We are little sedentary than Western world. So a combination of very rich carbohydrate rich food and less of activity and special genetic constitution of the Indians makes us very prone for diabetes, makes us very prone for obesity, and we are battling with a new issue of diabesity, that is diabetes and obesity. Many of the Indians who have migrated to US and the Western world, they carry the same genes. But because of the change of environment, because of the change in food habits, because of more of physical activity, the surfacing of those genetic traits of diabetes are lesser in the people who have migrated, though they are more prone to have.
Allow me to take you back to India. And earlier we used to hear that if you are young, you don't worry about stress, you don't worry about diabetes or blood pressure, but not anymore, I think. So the earliest age at which you have found someone diabetic?
You're absolutely correct. There's been a tremendous change in the age profile of these lifestyle diseases. When I say lifestyle diseases, diabetes tops, next comes the obesity, high blood pressure, cardiac problem, etc. Earlier, all diseases in our country used to be 50 plus or so. But you'll be surprised that now the age limit for diabetes, high blood pressure, obesity and cardiac problem have shifted to as low as 15 to 20 years. We have now increased incidence of type 2 diabetes in the younger children, increased incidence of high blood pressure and cardiac problem in younger children. Childhood obesity is another a big issue in our country. So there has been a tremendous shift of the age group of all these diseases in India. almost from 20-year onwards, which was not seen before. Hence,
I'm again going to the poetic and emotional side of it. So it is very unfortunate and it is a shocking thing to learn that the youth on whose shoulder we see the future not only of fulfilling their own dreams but related to the dreams of our nation or the world at large. So now your favorite side of awareness. So do you think awareness significantly makes a difference?
absolutely correct. I think here's a perfect statement you have made. There's a saying, eye sees what mind knows. If mind is aware that I need to eat carefully, if mind is aware that I need to be physically very active, if mind is aware that I need to be disciplined, we can avert all these lifestyle diseases. We run a program by name of AFL, Awareness for Life program, just to educate people. And I have a feeling in this era of education, in this era of communication, in this era of WhatsApp and Twitter, if you make the people aware of it, what is good and bad for you, what is the healthy diet, what should be the calorie content of your diet, what should be the percentage of carbohydrate and fats in your diet, this much of physical activity is essential for you, these are the preventive health checkups you should go for it. Probably we can avoid many of these issues in younger age group if we make the people aware of it. The receptivity of the younger age group is very good, that people receive the message very nicely, very carefully, because unless you make the younger population aware, otherwise all younger population thinks that they are immune to lifestyle diseases. They're too
Absolutely. They
young.
think they have whole life in front of them, and the kind of awareness
It is
about
a disease of father and the grandfathers. So I think making them aware of it, making them knowing what is a good and bad, making them physical activity, which is an integral part of preventing and taking care of lifestyle diseases.
So now let's talk about awareness. Whether it is whatever be the age group and whether rich, poor, male, female, I believe there are some universal principles about which you talk when you are sharing in the direction of increasing awareness, how to prevent diabetes. So talk to us about that.
In fact, the prevention of diabetes is one of the very important things, and you can just prevent diabetes as well as other lifestyle diseases keeping few principles in mind. A, you need to have the optimal weight. Never let your weight increase. The weight increases when your algebraic sum of calorie intake is more than calorie expenditure. If you earn more and spend less, the bank balance builds up. Similarly, the body's balance in terms of fat builds up if you consume more calories and spend less. So you need to be very adequately take the nutrition. The nutritive food you should take less of calories, more of fiber, more of green vegetables, carbohydrate, limited fat, and less of junk food. Your physical activity should be very important. In fact, the physical activity takes care of all the risk factors for diabetes, for obesity, the cardiac problem. There is one of the common problem in India. We call it to be insulin resistance or metabolic syndrome. It is a medical term, but the components of this metabolic syndrome I must share with you, which everyone need to know. The components of metabolic syndrome are more weight, more blood pressure, more sugar, more insulin resistance, and high levels of lipids, what we call it to be triglycerides or cholesterol, which everyone is aware of it. I think the integral part is a balanced diet, less of fat, adequate proteins and more of carbohydrate, adequate physical activity, keeping your weight optimal. Everyone, I must brief that they should know a term by BMI. Ask your treating doctor and consultant, sir, what should be my normal BMI, and try to be within the framework of normal BMI. If there's a parental history of diabetes or blood pressure or cardiac problem, I think you need to be little more careful than the rest of the world. Another very important thing is that to prevent the diabetes, it is very important that you start taking care from younger age group. You can't wait to be middle order or the elderly like father's age or grandfather's age. From day one, from adolescence, you start taking care of you in terms of food, nutrition, physical activity, as well as all the precautions you should take about it.
So talking about precaution and the formula, how much calorie are you consuming, and how is the calorie being used? Very few people pay attention to it. We just eat and we are just happy. But that happiness, if we want to last long, then what Dr. Sudhir ji just shared, I think we need to pay attention to that. And Dr. Saab, now let us talk about the second stage where someone has not paid attention, or due to the kind of gene that they have inherited, they are diabetic. And laymen also have started hearing about type 2 diabetes, or so we don't know much about what type of diabetes are there. But talk to us a little bit about once you want to keep it in check, any habit pattern that they need to work on changing, etc.
First of all, I must share with you, before I say what is type 1 and type 2, the good news is that if anyone turns out to be diabetic, it is a disease which doesn't affect the longevity of life if you are disciplined. So what a strong statement, that it doesn't affect the longevity of life if you are disciplined, and you can maintain the better quality of life if you are aware of it. Now the issue is that whenever someone becomes diabetic, our concern about maintaining sugar values are partial. There is a term by name of HB1AC which shows the 3 months average of diabetics. You need to maintain your sugar values normal, and 3 months average normal as per age, which doctor will tell you around 6 to 6.5, which is valid for both type 1 and type 2 diabetes. Now let me share with you what is type 1 and what is type 2 diabetes. Type 1 diabetes, it happens in the younger children, even newborn or juvenile people, and usually below age of 20. This is because of genetic problem, and the insulin producing capability of the body is not there. So you are totally insulin deficient. When you are totally insulin deficient, the only way you can lead a good quality of life is by insulin supplementation. Fortunately or unfortunately, so far the insulin is available only in injectable forms. The lot of research is going on in terms of the inhaler insulins or tablet insulin, but we are little far off from the reality. There are many modes of giving insulin to the type 1 diabetic in the form of insulin pumps, etc., etc. So there is a good quality of life. I must share with you, sir, there are a lot of celebrities in India. In fact, few of the film stars, they are top film stars, they are type 1 diabetics, and they are on 3 to 4 type of insulins per day. So my message to type 1 diabetics is, don't get disheartened. You can lead the best quality of life. Take help of a doctor. Body doesn't know whether you are taking insulin from outside or you are producing inside, but be very disciplined, educate yourself, do the calorie or carb count, and I think you can lead a very good life. Another thing is that they need to have a periodical checkup to decide the doses. Next comes the type 2 diabetes. You were talking about type 2 diabetes. Type 2 diabetes is a diabetes in elderly in which body is producing insulin but little less than what it should have, and the quality of insulin which is being produced is not of perfect type, so that your sugar controls are not adequate. Type 2 diabetes is little more prone to cause cardiac, kidney and eye complications. And as I was talking to you, what is the difference between Indians and the Westerners? We are more prone to develop kidney, eye and heart complications in type 2 diabetes because of our genetic and environmental factor. The biggest challenge in India is that this type 2 diabetes is now hitting the people of the middle order and lower order strata. So they are already hard pressed economically, and then challenges of meeting out the diabetic complications is another challenge. So the basic principle of managing type 2 diabetes is perfect nutrition you should take. The calorie count is very important. Regular physical activity is the biggest mantra to have the best quality of life. Periodical checkup is very important, which will include the eye, heart, and kidney checkup. The 3 months glucose levels are very important, and only thing is that you should live such positive life, keeping in mind that this is a disease I can control, I can live with it, I can have a balanced diet, and it is not going to affect the longevity of my life. So I think it is a disease.
Absolutely.
You can have the best quality of life. Secondly, there are certain do's and don'ts. A diabetic thinks that I can't have sweets, I can't have chocolates, I can't have pastries. The issue is that all the sweet things are having high glycemic index. It is a term which means that the moment you eat, the sugar level goes up. But sometime, if you want to go for these things, there is always a method of supplementing by total calories which are lesser. So by calorie supplementation, suppose you have taken something of very high calorie, you need to substitute it by more of salad and soup, which I'm sure your doctor will be able to advise. So keeping the calorie count, sometime indulging is not bad. Keeping your 3 months average in normal limit, and I tell you, the most important aspect, you will be able to control diabetes to 60 to 70% by best of the treatment combination. But to have the 100%, you need to be a very physical person. You need to be as active as you can be.
Wonderful. So, couple of things. I'll just recollect 2 points. One, you need to be physically active, so there is no alternative to that. Secondly, in indirectly way, Dr. Sudhir has encouraged people who are suffering from diabetes, or rather, he has made it clear that there are other celebrities also who have who share this diabetes. So, but don't think that you are a celebrity because you have diabetes. So there is different kind of logic. But doctors have now considering the situation that you are in, so much wealth of knowledge and passion to increase awareness, and also you are in close proximity of Chief Minister of Rajasthan as well as Governor of Rajasthan, and so as a physician and someone who is so considerate and compassionate, do you see there should be restructuring of government policies on some level, and do you find yourself, if not officially, unofficially, in the advisory role in terms of the way government policies would be more effective to help us keep the growth of diabetes in check?
I must share with you, we are very lucky. Our governments are very sensitive. They've started a special program for non-communicable diseases, which includes obesity, diabetes, and cardiac problem. These programs for non-communicable diseases, which caters cross-section of society, which involves the screening of the population, which involves the early enrollment of the population, which involves the free lab testing, the free medications. To be honest, the government is extremely sensitive and we are very lucky. For example, the medical college hospital where I'm working, we have plethora of the patients. You'll be surprised. All investigations are free, all medications are free, the insulins are free, and government is so sensitive that patients are so privileged when the best of medical advice is available, the best of investigating and the therapeutic things are available free of cost. I think we are very privileged to work in a medical college hospital, and we have a national program for control of non-communicable diseases in which the diabetes, blood pressure, heart problem and obesity comes. So probably we are very happy. There has been a suggestions from all the medical bodies and conferences, and which has very well been implemented, and all such programs are running, and there is a very specialized screening program, treatment program, and this program which government of India has, the management program for non-communicable disease, it starts from the lowest hospital in a village to the highest tertiary level hospital. So I think massive drive is there to A, prevent this, B, to contain it, and see to avoid the complication it. And one of the integral part of this program by government is public education. And I have a feeling these days you make people aware what is good and bad. Probably most of the people follow. So I think the receptivity is very high, and I think our stress is more on education than treatment, and I think patients follow it very well.
Absolutely. Thank you very much, Dr. Sudhir ji. Being with you makes us happy that we are conscious that if there is a deviation in our health pattern, then there is a way to correct the path that we have chosen. And what needs to be done when that becomes clear, it is empowering in a very special way, and you are empowering at different places by disseminating this valuable information, which is lifesaver at many places, I must say. And I have had the privilege of listening to you, and you are such a wonderful communicator, and so people grasp what you are saying, and they are encouraged and inspired to implement those suggestions from you. So with lots of good wishes.
Only last message I'll give to my viewers, that rest assured, A, there's a way to prevent diabetes. B, in case someone has been diagnosed, never lose heart. You can lead the best quality of life, better than many of the non-diabetics. Best way of life you can lead. Just be little disciplined, just be little physical, and believe in calorie count, and be in touch and guidance of a doctor. I think absolute good health and good quality of life you deserve, and you can lead.
Absolutely. Thank you very much, Dr. Sudhir ji. Such a pleasure having you with us.
Thank you very
And
much.
as I thank him, I thank all of you for being with us in the journey of learning more from someone who we must say is not just a dry expert, but a soulful expert who has come, senior professor from SMS Medical College, Jaipur. We got the opportunity of talking to him here at the 29th annual convention of Rajmai. So that's another credit to the roots of Rajasthan, and Medical Alumni Association made this possible for me to interact with Dr. Sudhir here. So I thank this wonderful organizer as well as you with lots of good wishes for one and all. This is Ashok Vyas.
तक है हंसी और मैं जवान, तुझ पे कुर्बान मेरी जान मेरी जान। ए मेरी ज़ोहर जबी तुझे मालूम नहीं, तू अभी तक है हंसी और मैं जवान, तुझ पे कुर्बान मेरी जान। ये शौकिया ये बागपन जो तुझ में है कहीं नहीं, ये शौकिया ये बागपन जो तुझ में है कहीं नहीं, दिलों को जीतने का फन जो तुझ में है कहीं नहीं। मैं तेरी आँखों में पा गया दो जहां, मैं तेरी आँखों में पा गया दो जहां। ए मेरी ज़ोहर जबीन तुझे मालूम नहीं, तू अभी तक है हंसी और मैं जवान, तुझ पे कुर्बान